Upper airway resistance syndrome, or UARS, is a sleep breathing problem. It is like a patient is breathing through a thin straw at night. This leads to sleep fragmentation and multiple arousals throughout the night. The difference between UARS and sleep apnea is that in sleep apnea, the patient actually stops breathing. With UARS, if there's an obstruction of the airway for a couple of seconds, then it causes an arousal, and then the individual begins breathing again. The problem with the diagnosis for UARS is right now there's not a good diagnostic tool. Our current sleep tests either diagnose a patient with apnea or no apnea. The individuals with UARS are then just misdiagnosed as having snoring or idiopathic hypersomnia, which is a fancy term for excessive daytime sleepiness. In adults, UARS can be successfully treated with CPAP, a mandibular advancement device, and sometimes even orthodontic expansion. UARS is very common in young, fit females. They have a tendency to have an undersized craniofacial respiratory complex, which includes a narrow, high-arched palate, long face with a short, narrow chin, early extractions to remedy crowding, a narrow nose, and jaw joint dysfunction. It was previously thought that UARS was a precursor to sleep apnea, but is also now recognized as its own independent condition. Many of the common symptoms of UARS are excessive daytime sleepiness, high anxiety, cold extremities, low blood pressure, headaches, irritable bowel syndrome, and early signs of autoimmune disorders, including fibromyalgia and chronic fatigue syndrome.